Starting now. Greetings. Alone you can do so little, together you can do so much. These are the words of Helen Keller that resonate with the predicament Miss Sarah Burns encountered in efforts to seek healthcare. She's an 18-year-old transgender on feminizing monotherapy who presented the BRAINFUSE Center with a chief complaint of persistent right wrist pain for 4 weeks, despite taking over-the-counter ibuprofen and having had a therapy session at a previous clinic. Besides this, she also has a history of no-resolved musculoskeletal injuries at the arms and shoulder. She also experiences poor feeding habits, declining school grades, and anxiety, just to mention a few. Also worth mentioning is that her parents actually divorced after being separated for around 3 years. After traffic inquiry for the cause of her pain, it was established that the mother's boyfriend Tom was responsible. Impressions derived from the HCR, physical abuse from Tom causing right wrist pain, depression caused by parent separation, gender dysphoria, and asthma.
Strengths drawn and lapses with regards to the previous IP care for Ms. Sierra are shown on the slide. One strength that should be noted is the proper referral to the following healthcare professionals. Notable weaknesses include not probing the underlying cause and consultations that were not holistic and merely symptomatic and relief in nature. To address these concerns, our group created a modified IP collaboration model to improve Ms. Sierra's clinical care. Healthcare providers must be acquainted with each other and their distinctive roles and responsibilities, which should be clearly defined at the start while considering each member's expertise and limitations. The team should also be well-oriented on effective teamwork and communication. An open and honest communication must be set in place. In this case, technological advancements may be explored. Team dynamics should also be discussed at the beginning and should be adjusted accordingly. Additionally, it is imperative that health-related decisions be made in accordance to Ms. Sierra's goals and concerns. Barriers to access to health services, such as transportation issues and gender-based disparities, must also be considered. The team must be emphatic, must uphold self-determination, and should be well-versed on domestic violence and abuse, as well as transgender health. Lastly, the IP team must also be proactive, such that preventive care is given equal importance as reactive care. As such, public health initiatives must also be in place.
So to attain more holistic health outcomes for Ms. Shara, a diverse healthcare team needs to be actively involved in her management. So a primary healthcare physician will be her first point of care and who will be responsible in prescribing the appropriate analgesic for her right wrist pain. Also in managing her asthma conditions by taking part in assessing asthma control and adjusting her medication therapy accordingly. Switching from fluventiscus to fluticasone-containing MDI to increase patient acceptability, reinforcing self-monitoring through symptomatic or via use of peak flow meter, and creating an action plan with Ms. Shara. Other roles of the physician will include collaborating with the pharmacist to provide patient education on proper use of medical devices, avoidance of asthma triggers, and clarifications of medication indications. Also, following up Ms. Shara's progress and properly referring her to specialists and other relevant members of the IP team. A psychiatrist shall also be involved in providing definitive diagnosis for gender dysphoria and major depressive disorder. Also in delivering the appropriate treatment in forms of pharmacotherapy and psychotherapy. Additionally, to assist along with a social worker to build support system for Ms. Shara. So the social worker shall also be responsible in assessing relationship dynamics within Ms. Shara's family and to assist to ensure safety of Ms. Shara by creating safety plan and alternative living arrangement. So as per Michigan law, social worker can assist with Ms. Shara by helping her be exempted from visiting Madison until she turns 19 and a half or until Tom's anger management issues have been resolved. Also, to provide individual and family counseling services and to engage with Tom and help him with changing his behavior and to advocate an insurance agency for Ms. Shara's trans-specific care.
Additionally, the team should also have a radiologist who shall perform and interpret additional imaging modalities such as MRI as suggested by the physician. A physical and occupational therapist to offer physical rehabilitation to attain normal functioning of the wrist. To help Ms. Sierra with her transitioning phase, an endocrinologist along with a pharmacist shall evaluate the effectiveness and monitor the side effects and drug interactions associated with her hormone therapy. In case Ms. Sierra wishes to proceed with gender reassignment surgery, a plastic surgeon should work with the social worker to assess eligibility and ensure preparedness. The surgeon should also provide patient counseling and must lay out an aftercare plan for the surgery. The pharmacist in the team will assist Ms. Sierra in managing her prescribed medications, namely feminizing hormone therapy, as well as her asthma medications. Also liaise with the social worker for patient education initiatives. Further, to assist Ms. Sierra with her dysphagia, the team shall also need a nutritionist, as well as a speech and language pathologist. Public health professionals should also be involved to educate and empower the community about domestic abuse, mental health, sexual orientation, and gender identity. To collaborate with social workers and policymakers to develop policies and interventions to address the aforementioned issues. Explore innovative solutions for barriers to health, such as transportation access, as well as to evaluate the effectiveness and quality of health services. Finally, all members of the IP team should work closely with Ms. Sierra and her family, which are at the center of the clinical care.
IP collaboration is indeed crucial to ensure holistic assessment. Ms. Seriar's case should drive Fichtensberg's healthcare community to strengthen its IP collaboration and to place more emphasis in overcoming barriers to healthcare access.
Those are our
That's
references. Thank you. Any questions?
Thank you.
Thank you very much, second team, for your great presentations. Without any ado, I would like to give the floor to our judges. We have 8 minutes now for questions. So who wants to break the ice?
Okay, I'll ask my first question. Well done on this really well presented presentation. I really like the way that you have presented the information. I also like the way that you've highlighted the important or the role of the different healthcare professionals. My question is here is you didn't really focus a lot on how the team will work together. Like you mentioned, the plastic surgeon with the social care worker, and you've listed quite a number of the different healthcare professionals that will be involved. But reflecting on the meaning of interprofessional collaboration, how will these team members actually work together? And my second question is, I've noticed some of the healthcare professions, you've listed quite a number of roles and responsibilities, whereas for others, it was like maybe a line or, two. And you've also combined, I think, the speech therapist with the nutritionist together. So if you can highlight on this, that would be great. Thank you.
All right. Okay, so for working together, so as I mentioned in the interprofessional collaboration model, so one of the highlights here is the communicative and collaborative teamwork, where an open and honest communication as well as efficient team dynamics is essential in delivering quality healthcare for Sierra. So in terms of collaborating with each other, so proper referral is a must. So of course, with proper referral comes proper communication medium, such as right now we have to take advantage of technology, where doctors and other healthcare professionals have now different platforms where we can use social media such as Facebook, Messenger, etc., or the classic face-to-face interactions between the healthcare professionals is crucial in delivering interprofessional care with regards to Ms. Sierra's care. Now, for the other question, with regards to the responsibilities, of course, with these single line bullets, we don't intend to undermine the importance of each and every healthcare professional involved in Ms. Sierra's care. So, for example, in the radiologist and for the PT and OT, they may be just one single line each, but each of them is very crucial in delivering Ms. Sierra's care. So we don't measure here how many or how big the load is, but rather how important the load is in delivering Miss Sierra's care, which is as equally as important as every member of the healthcare team. Now, for the last question with regards to the speech and language pathologist and nutritionist. So this one, as we have probed through Miss Sierra's interview, so Miss Sierra was experiencing food dysphoria and also dysphagia. So for food dysphoria, since we've noticed that that Miss Sierra has been losing weight recently, so the nutritionist will help in gaining in assisting Sierra through a feeding program or other possible ways to help gain weight for Miss Sierra. And then for the speech and language pathologist, of course, the dysphagia will help, and the dysphagia contributes a lot to the loss of appetite as well as loss of weight for Sierra. So resolving the dysphagia by the speech and language pathologist will greatly increase as well and aid in the weight gain program of the nutritionist. Thank you. I hope it answered the question.
Additionally, regarding the speech and language pathologist, besides the dysphagia, they really help in the feminizing role that Sierra now seeks in terms of making the speech more feminine. Thank you for the question.
So also in addition with the IPC, we can take advantage of technological advancements. So for example, we can have multidisciplinary team meetings via telemedicine. So this can increase efficiency and collaboration irrespective of location. Thank you.
Thank you.
Thank you, team, for the answers. We still have some minutes left. 3 minutes and a half. Any more questions from the panel?
If I may go, thank you very much for an excellent presentation. I was particularly impressed in you looking at the public health professionals addressing community problems at large. So I'd just like to know or see how you foresee the interprofessional team dealing with the crime-related aspects of abuse potentially, especially that's had been noticed by the boyfriend of the mother.
Brad, would you like to answer? Or?
Well, first of all, to address this issue, we need, as Sierra mentioned, she was scared of opening up. So for this, we'd have to reassure her that it happens to other women as well, and she's not the only one. So we'd have to assist her with that. And that's why we have involved a psychiatrist and a social worker. The social worker would explain the situation to maybe Sierra's mother, who's not understanding, and then maybe also talk to Tom for his anger management. And since his anger management could be aggravated by the alcohol abuse as well as smoking, so maybe we'd try to tell him to adjust with that. And as per the psychiatrist would help her mental health, how she has been affected with it. And as for public health officials, since alcohol abuse is something that's happening in Fichtenberg, so maybe we'd have campaigns to show how the alcohol affects the society. So basically that.
In addition to that, in collaboration with Miss Sierra's and Tom's psychiatrist and as well as social worker, the social worker and the psychiatrist might be able to pinpoint what exactly causes Tom's violence, which will further help guide the public health professional in formulating what guidelines are necessary or what regulations must be put in place in order for to prevent future cases such as Sierra's from happening.
Thank you.
Thank you.
We still have 1 minute for questions. Any final questions from the panel?
I wanted to say congratulations to the team, and I think this was a very interesting take on the case, and your presentation was easy to follow. Your graphics were on point, well done. Just
Thank
one
you,
question, in addition to what Dr. Ala has pointed out. So we've seen that you have presented multiple professionals and their roles in Sierra's case. How best would you make sure that this team is efficient? They might have a specific place where they are communicating electronically and they're meeting across the board, but how would you make sure that it's efficient and it's resulting in improved outcomes for Sierra? And it's very easy for all these issues to be well communicated, but sometimes it might not be as efficient as we want it to be. So in this particular case, how best do you think we can ensure efficiency in these multiple professionals in working on one case?
Juni, would you like to, or would you like me to answer?
Okay, for what we had thought about was that since the first person that Sierra meets is the primary health physician, so he would be actually a leader. So he's the one who's going to follow up that she goes for the various referrals that she's been asked to do. So the approach would be that the primary health physician would be the leader and would be following up with Sierra for her referrals, basically. He shall lead the communication.
Yeah, and maybe we can adopt communication models and do check-back approach also to follow up and to ensure that efficiency is there.
Thank you, team. And the time is over for questions now.